think the first thing I have to explain about an N95 respirator, that you get several kinds of different respirators. It is only an N95 respirator if it says N95 respirator or N95. It has got a certain code on it. Now N95 stands for 95% efficient rate for a particle of 0.3 microns that will penetrate through this respirator. It is a medical device. You must treat it very carefully. If you would fold it, it loses its ability to actually work and you will not be protected. You only take this respirator out once you are ready to use it. Usually, we only use a respirator once. That is the way that we use respirators. But only and only in a pandemic, when we have a shortage of respirators, can they be cleaned. Now, one of the ways is that I can put it into a brown bag. So you must make sure that you don't touch the surface there, the front surface. You can put it into the bag. Make sure that what you have is your name and the date on there, because what you're going to do is you're going to reuse this. Close it up. Remember another thing. This is a surgical mask. A surgical mask is never, but never, to be worn first and then the respirator over this. I've seen so many people doing this. This is wrong because it's important that you have a seal on your face. If you do this, you will not be able to actually seal your face. All right. What you can do is to do it this way around, where you're actually protecting the outside surface. And what we are doing, because we are cleaning and reusing our respirators, this is a proper way in which you can do it. So first, your respirator that fits on your face, and secondly, what you see is basically the normal surgical mask over this. Okay, and removal is, this is thrown away, this is reused. So one of the ways in which you can reuse respirators is that I give you 5 respirators. You put them in a bag like this, and it is protected. Never put them into a plastic bag, because if you put them in a plastic bag, what will happen is the moisture from your mouth inside the respirator will actually make things to grow inside there. Remember that your breath is not sterile. This is then put somewhere safely. It's only the 6th day that I can reuse it. There are other ways in which it can be cleaned. Ultraviolet C, there's hydrogen peroxide, and of course there are also moist heat that you can use to actually clean them. If you want to reuse it the next day and you have only one, after I clean it, I put it in here, a clean bag, and then I can reuse it the next day. Do not reuse them if they don't fit you anymore, and make sure that you do not infect yourself when you are doffing this respirator.
You should discard your N95 respirator under the following circumstances: after the use during aerosol generating procedures, if it has been contaminated with blood, respiratory or nasal secretions, or other bodily fluids from patients, and following close contact with or exit from the care area of any patient co-infected with an infectious disease, or if you accidentally touch the inside of the respirator.